program, and yet they never started. So some people are not coachable.
Hello, everyone. Good morning. Hi. While joining us, please mention where you're coming from. Yeah. Welcome, everyone, and thanks for attending on time. Yeah.
السلام عليكم جميعا.
عليكم السلام ورحمة الله. أهلا.
Hello, everyone. Thanks for attending on time, and please mention over the chat where you're dialing from. Hello. We'll start in a couple of minutes, inshallah. Mohamed Muzafi from Tehran, Iran. Hello. Yeah, hello. Welcome. Shukran from Saudi Arabia, Lina from Jeddah. Yeah. Welcome, everyone. Oh, Jeddah from Lithuania. Well, welcome. Anna from Poland. Yeah, that's truly multinational and a very diverse spectrum of audience. Yes. Hello. Welcome, everyone. So we can actually start in a couple of minutes. Just Rasha, how are you, Rasha from Riyadh? Yes, how are you? As we are waiting now for the start, we're just we'll start at 11:03 or 04 as everyone can join, and then we can start our session. Hello, everyone. Hello, Afia. Just mention where you're coming from. And we'll start in 1 minute. Yeah. Oh, hello from the Philippines. Hello, Edeline. Yes. Now we have Asia Pacific with us. We're having Middle East and we're having Europe. That's great. That's a great place to start from. Yeah. Hello, everyone, and welcome, and thanks for joining us in this webinar, which is part of International Coaching Week under the titles of, or the motto of Elevate, Innovate, Celebrate, and coming into the space of innovation and elevating the coaching practices. Myself and Coach Haitham actually agreed together to maybe create an opportunity in the healthcare industry of how to introduce the team coaching to transform the healthcare systems, and how team coaching, I'm an expert in team coaching. Haitham al-Masri, Dr. Haitham al-Masri is actually a coach and at the same time an expert in the healthcare industry and its consultancy and transformations. And we saw an opportunity here to innovate through introducing how team coaching can support the healthcare management industry. So welcome, everyone, and hope that this will be a breakthrough or an introduction to maybe tease the minds and maybe open the opportunities for experiencing team coaching in the healthcare industry, which is still a green field and an area that's still a little bit untapped. Giving a brief introduction about ourselves. I'll start by myself and then hand over to my colleague and co-panelist, Dr. Haitham. I'm a father of 6 and a stepfather of 2. I also fell off a mountain. Maybe I was hospitalized a lot in my life. Spent a lot of time in the hospitals as a patient. I'm not from the healthcare industry because I'm an engineer. So I also and actually from the perspective of ICF, I'm a master certified coach, and as well I obtained the certificate of advanced certificate in team coaching. As well, our organization, Authentic Coaching Academy, is accredited as a level 2 PCC that can support you to achieve your PCC level of coaching. And as well, we are one of few in the Middle East who have the advanced accreditation in team coaching. Currently, I'm a volunteer in ICF as a global ambassador of the Global Knowledge Community, which is focused on the coaching education. Previously, I was a volunteer in the ICF team and group coaching community of practice. I was a co-lead, and I ended my term of 3 years since 2021 till 2024. I will pass over the mic to Haitham to introduce himself.
Thank you, Sharaf. It's my honor and pleasure being with you today. Since I started the coaching journey, Sharaf was my mentor, my guidance, and actually he's a good inspirational part. Usually, whatever I start with him, I feel that there is some serendipity in the background. So thank you, Sharaf, for the invitation today, and welcome everyone. My name is Haitham Al-Masri. The most challenging part of my introduction is related to how I present my history. But I start as Sharaf gave me some tips about being a human. I'm father of 3, Ahmed, Saif, and Omar, which is my treasure. And I hope you have everyone with صحبة صالحة. I'm ex-basketball player, which I used to be my ambitious and my inspirational part. Unfortunately, no. Currently, no. After swallowing the ball of my body, I'm a temporary person, and this is my mantra. I'm a temporary person in a temporary place, which I believe I'm connected. I try to be connected with the values. From ICF perspective, I'm the vice president of Saudi chapter, volunteering as ambassador of ICF Health and Wellness Community of Practice. Also, I was selected as a wisdom waiver for Institution of Thought Leadership of ICF, focusing on the future of well-being. We published some articles related to the future of well-being, either for the workplace or in healthcare. I am believing in healthcare, the real healthcare, the value-based healthcare, and get the graduate from Houston University as a value-based care consultant. Focusing on the consultation and healthcare, my main core is related to the transformation of healthcare system. And I would be happy to share the discussion today with Sharaf about the value of healthcare and the role of team coaching for this transformation journey. Thank you, Sharaf. Back to you.
Thank you, Haitham. And I believe that Haitham comes in with a great experience in the healthcare industry. And please connect with us on LinkedIn. Pass on your LinkedIn profiles and add each other. It's an opportunity to network and connect. Today, it's more of an interactive panel as we spread over some ideas. Actually, we don't have real hands-on, for me, I don't have real hands-on experience in applying team coaching in the healthcare industry and management, because still we find some resistance in the region, or still it's by far, it's a little bit not yet comprehended, and not everybody understands the value, and still it's taking its toll of, development and putting, so we're mentioning here more of opportunities rather than practical experiences. The practical experiences are maybe in some papers and studies from some specific parts of the world, and still it's an opportunity where it's a green field. There are a lot of like applications that were documented and researched. So we are just opening here a door, and we are mentioning where the opportunity lies, and whoever have the power to grab it or just to move it, because we are really concerned about how the healthcare is treating the patients and actually bringing real health and to the essence of the system. So please make it a two-way communication. These are just our ideas, and we'd love to learn from you also, from your questions, from your advices, from your inputs, how we can elaborate on this and create this opportunity into a solidified experience with one of the healthcare industries or the governmental aspects of this stuff. So I'll move on to the next slide, and maybe at this, I'd love to actually learn from you, Haitham. How is the industry shifting from the sick care to the healthcare, and what are the major shifts that are happening in the healthcare industry?
Thank you, Sharaf. It's a very good start to start with this point, especially that for everyone coming from healthcare sector, understand what the difference between sick care and healthcare. Unfortunately, the current status of the global healthcare system is mainly focusing on treating disease. And there is totally different between treating disease or managing patient or caring about health. This is 3 steps is totally different with totally different perspective. 8 years ago, in the launching of the global standards, global development goals, the goal number 3 mentioning the accessibility for healthcare services to everyone. From this point, it's a paradigm shift. And this level, we're focusing on how we can make a healthier life for each person. By this way, a lot of perspectives coming in mind or coming on the real life to to understand what does the patient need, how we contribute or include the patient in the healthcare decision-related health-related decisions. Third, moving forward for preventive care. And it will not be happen by one click. It's need a paradigm shift. The key word here, it's related to the collaboration. How we make the real patient centricity for the health system at the essence of everything. So to moving from sick care, in a short answer, moving from sick care to healthcare needs some keywords: patient centricity, collaboration, understanding of the future to preventive care.
And I guess, Haitham, here when we're talking about this, it's always the triggers of sickness that drives people to go to the healthcare systems. So I believe that there is a total new approach that is maybe introduced currently when we're maybe buying the new real estate, the smart cities and this stuff. There's a little bit of new terms, like of just monitoring the health risks or checking, your well-being and managing your well-being. And this is a space, I guess, that healthcare is actually moving to. It's more of not looking to you as a patient, more of a healthy well-being and putting you in the center of, your well-being is their care. So it's a little bit, different than, the triggers that we are used to go to hospitals in the past. And currently, I guess, the healthcare system should provide something different. So can you maybe mention a little bit of things that are future casted and maybe implemented in some places?
Sure, yes. Thank you, Sharaf, for mentioning this. I guess the point here is who will take the decision. The previous one in the sick care context, usually the healthcare practitioner is a decision maker in many levels. Meanwhile, the future of healthcare, the real healthcare system, the human, it is not the patient anymore. The human will be the decision maker. I will take the ownership of the decision maker. between practice with the right level of knowledge. And this transformation, it's need a lot of new competencies acquired in the healthcare, especially from healthcare practitioner side, moving from decision maker to facilitator to the right decision. It's acquire a lot of things that happen in the healthcare system. Based on my existence now and my exposure to the 2030 vision of Saudi Arabia, I can easily link it what I'm saying with the future of transformation of the healthcare system inside Saudi Arabia to facilitate what we call value-based healthcare. Mm-hmm. If we go for the well-being, it needs money. And if we assess the quadruple aim of healthcare, money play a very important role. The cost of services impact the sustainability providing this service. To adding the well-being side, it could cost more money. Frankly speaking, it's the opposite. If we care proactively or predictively with the well-being or the elements, this can minimize the cost. Again, with the right level of knowledge, the right level of education, the collaboration between the healthcare practitioner, the patient, to take the right decision that's relevant to the health for better public health and individual case as well. I hope I answered your question, and if you need clarification, please let me know.
It's I believe it opens very much new horizons, and it needs culture shifts not only on the healthcare providers and the healthcare systems, but also on the patients and the human beings who are actually citizens who are, like clients to this system, or who are al-mustafid, or like this person who is really the beneficiary of this service may need a new shift in paradigm and how to take ownership. Actually, you're moving the ownership of the decision making from the experts hierarchy of hospitals with this current mindset into the person himself, or the human being who is taking the care. And I guess this needs a major shift on the national level, international level, because some of us are actually international citizens who are actually moving from one place to another. So having variety of differences of healthcare systems may confuse some.
I can't agree more about this. Usually, many things happen in the healthcare due to the reactive mode, minimize the cost, maximize the cost. And the other side, it's made a lot of challenges to make a real healthy outcome. Quality of life is a key word to build on this. And I will echo what Afia mentioned in the chat about the capacity, the healthcare capacity. The gap between the current capacity and the demand, maybe another trigger to have another approach. If we have the same capacity, it will not be longer sustainable. This change could happen with the presence of new competencies to serve more for longer time. And here, this is a transformation also coming on the ground. I hope I answered the question of Afia on the chat. And also, this is another trigger to make, let's design a new healthcare system, global one.
Thank you, Haitham. And I believe that the vision of 2030 in Saudi Arabia is not independent of what's happening globally. And maybe it's leading in the region in the way it's implemented, or in the way that they're actually implementing things that are actually more courageous than maybe the neighboring countries. And this may lead actually into some experiences that may actually look a little bit, a little bit, like there may be some mistakes, there may be the lessons learned, there may be some sort of mishaps, but it will be in a way leading everybody else in the region to understand what it takes to move forward in this model.
Yes.
And thank you for being part of that. So, yeah. So maybe if you want to maybe elaborate on this slide or something, it's talking about the history of, how, like we look at the healthcare journey from, like the patient-centric centered care. Yeah.
Yes. It's a very good thing that we need to understand that transformation, it will not happen by easy way. The journey maybe take a lot of years, a lot of centuries to build a very comprehensive model. What we see now, it started maybe 150 years ago with the concept of the patient-centered care as a concept. As we have treat patient or treat disease. This is the key question at this time. Then moving that we cannot treat a patient individually, and 60s of the previous century, talking about the multidisciplinary team. It is not a decision for individual. You have to see the perspective. Then the multidisciplinary team coming on the ground to understand how we can have a good referral model to share the insights and building a care plan with a very comprehensive perspectives. In 19th of the previous century, the patient advocacy or the shared decision-making transform on a certain level about the decision-making process, how we include the patient to be a part of these decisions. And we emphasize on this for the team coordination. This is a global roadmap, but it's a transformational, the previous 4 years, what we call the value-based care. Value-based care is initiated in US, focusing on the 2 dimension. I have to mention very important pillar. The healthcare practitioner maybe know this is very well. We usually used to have a triple aim of the healthcare system. What is the triple aim for any healthcare system? First one, the patient outcome. I suffering from a disease, I have to be treated from it. Second part is the cost. I have to make less cost to improve the sustainability of offering this disease. Third part is the patient experience or patient satisfaction. So the patient should be satisfied with these services that happen. This triple aim change in 2020 to be a quadruple aim. What's added in this triple aim, which is provider satisfaction or provider experience. The healthcare practitioner itself burned out. The highest domain suffering from burnout was the healthcare practitioner. About 70% of healthcare practitioners globally suffering from burnout. So this will affect the sustainability as well. The value-based care focusing to make this quadruple aim, this is our campus to ensure providing this right. So what we have now as a dream or baby steps initiating to the sustainable healthcare system coming from this long journey. And from this part of the chronological milestones that you mentioned, Sharaf, in this slide, I guess the future coming here with the right contribution or the right equilibrium between these quadruple aim.
Oh, I'm really, like how you're bringing this into life and context of the current culture and transformations. I guess also there is another polarity that's coming in, and it's maybe unofficial. Like it's placing itself in the world systems, but it's a voice that's coming in, which is the holistic approach or the holistic medicine that integrates traditional medicine with the Western medicine and maybe provides, like the very old, healers approach to like it's working non-formally, but I'm not sure how it is integrated currently in the modern systems because, like in a way, it's a voice in the system that's calling in, like to reduce the number of, specializations and look at the patient holistically from different and at the same time, it's providing traditional versus modern techniques. And is this in the map anywhere? Like how do you see this as a future perspective also, and to be integrated also in the healthcare systems?
This is valid point, and I guess it also linked with what Noel mentioned in the chat as well. We have two dimension or starting point. First one, the regulation. The regulation putting everything in the right frame, but it will not be happen on the ground until the mindset of the beneficiary and sponsors do this. Here I mentioned the healthcare practitioner. The model that I can refer on this currently is Saudi Arabia healthcare system. The regulation now building the value-based healthcare units. There have some incentive from the payer side, like the insurance companies, to bonus the healthcare practitioner, which provide a good quality care with proper satisfaction. Second part, which is from my side or my observation, is the transformation of the mindset. How the people will play the role to embed the new acquired skills to the healthcare system. And this is, I guess, our webinar here could be a good point for discussion and start to make the healthcare practitioner. You know, Sharaf, previously, it used to have in our region for the healthcare practitioner, which called Hakim. In English, it's wisdom person. It's coming from how to move the healthcare practitioner to get back to this, to get this title, to be a wisdom, to understand when can I refer, who can I discuss with, what we can include to a comprehensive approach for better healthcare outcome. And this is the point that I guess we need to have better space today to discuss how to empower healthcare practitioner to get the wisdom title again.
Wow. So it's the wisdom is not about the knowledge and not about the expertise. It's more about asking the right questions and facilitating the right direction. This is what I understand, right?
Exactly, and including the right stakeholder on the right time.
Yeah, okay. This is just the saying of Mahatma Gandhi, a small body of determined spirits fired by an unquenchable faith in their mission can alter the course of history. And currently, when we're talking about the healthcare industry and its trends in its changing, it's changing and it's transforming to, it needs an amazing spirit of those who are taking care of it. And that's why in the International Coaching Week, and today we maybe are mentioning and putting some highlights of how coaching can support these large spirits and amazing spirits in their mission towards transforming the healthcare system. So actually, as a you know, like as somebody who have been in hospitals, has been hospitalized, and my family for a lot of you know, like I've been. We see a lot that there are some prejudices between different departments in the hospitals, and it's even seen and sensed by those who are actually receiving the service, between the doctors, between the nurses, between the administration, the management, and the management of the hospital industry. And sometimes the systems itself and the regulations and the financial regulations, you know, like they sometimes collide together. You know, like you're expecting a service that gets too much delayed until they resolve their issues with each other. You may actually stay in the maybe ER or something until, you know, like nobody is taking care of you because of an administrative shorthand or something that's delayed, or somebody who they don't find to get their expertise or answer. And maybe there's a lot of gaps seen between the multidisciplinary teams. And any observer from outside the healthcare industry can see the prejudices, can see the egos also playing a big role, and the hierarchy, you know, and this is something that's obvious, you know, like it doesn't need researches or doesn't need backup, you know, like evidence to maybe to put in research or something. However, it's in some very few hospitals, which is outliers. I can say that they are outliers, and they're not the mainstream hospitalization or not the mainstream healthcare providers, you can see that there are some, like leadership models that really give some good answers on how these multidisciplinary teams work together from the patient-centric approach, from the process side and from the collaboration side. So maybe I guess that with this in hand, this may be the biggest challenge in transforming the healthcare system.
Sharaf, if you allow me for this picture, because it's very inspirational to me, and I'm asking myself a question and you as well. If they remove their hand now, what will be in the middle currently?
The floor, nothing.
And what we aim, thank you, Lina, for sharing the insights. Noel mentioned in the chat that ideally it should be the patient. Thank you. Thank you. But frankly speaking, it's very tough to put the patient in the middle of everything. But we have a metaphor that can replace the patient, which is the medical record, the unified medical record. It's very hard for collaboration. The competence is very important, but also, again, the story have two sides usually. First one could be the soft skills or the competences and its mandate. Second part, how the system to enable this collaboration, if we consider competency of collaboration is a part of this discussion. The unified medical record is a platform that this multidisciplinary team can talk to each other. As you mentioned, time spent without services, it's a leakage, it's a cost, it's a time of low quality services as you're suffering, Sharaf. But if we have a unified medical record and system raise alarm to the other part to take the decision to make a proper intervention on the right time, here the system will serve the collaboration. How do you see this?
Yeah, I guess it's sometimes you feel like the healthcare industry is losing its compass towards the essence of what they are providing. It becomes a money machine. It becomes a, like sometimes they get even in the administration teams, they become even defensive without any, any reason to be defensive. And instead of collaborating, they take a defensive side. Sometimes the nurses, they're just feeling hostility, and you feel the antagonism of how they deal with the doctors. You feel it, and you feel uncomfortable receiving the service in the end. You just go there and hope that you get your prescription and run away from this place.
And following this, without any surprising part, even the healthcare practitioners suffering from burnout because of this, because this will have the less of collaboration, the more burnout and conflicts. So Sharaf will left the hospital unsatisfied. They have to finger point who's responsible for this. And here it will become internal conflict between the multidisciplinary, the vicious cycle coming from this part.
Yeah, and I like this input that's coming in from Noel, that institutions need to secure their commercial interests as well, sadly, because this is it, mostly now it's privatized in most of the countries, and it's getting and you're talking about the cost element, which is also in the public domain. It's important. So sometimes, like the stakeholders who are actually, they're protecting the costs and protecting the interest or the return on, the patient treatment. So this is in a way, like creating a dilemma and major conflicts of how the healthcare teams are working together, and what is the biggest interest and what is the biggest, intention they're having. And some of them are just doing it for life and not for a purpose. It's just for a living. It's just, like fate took them into nursing, took them into hospital administration, into being a doctor because of, like the family legend or something. And this is a way to make money and live a quality life. It's not for the purpose of healthcare itself. and not driven by purpose as they should be.
It's very good, but let's have another objective. I totally agree with you. The current status have a lot of faults related to the commercial, patient satisfaction, quality of care, the provider experience as well. How we can coaching, and I guess this is a question coming to my mind now for you, how team coaching can help healthcare practitioners to get good money. When I mean good money, it's related to coming from the satisfied patient or satisfied citizen.
I guess, like this is with no experience in team coaching, but with other industries. We have to acknowledge all of these voices. Like the first thing is, yes, we have a patient in the center, yet, and the healthcare, like the essence of the system, but there is profitability to take care of. There's also individual dynamics or individual intentions that needs to be acknowledged, whoever is here because of maybe a professional practice, because of, making money or having a good life or something. This needs to be acknowledged. Also the cultural differences between others. I guess from what we have seen in other organizations who have multidisciplinary teams, that maybe putting this in front of the stakeholders as well as the team and acknowledging this, at least this makes a space to start where we can actually start aligning and taking the conflicting agendas or the conflicting intentions or the conflicting driving forces into, like more aligned approach, or integrate them together in one unity of a vision, so we can understand and have empathy towards each other. If I'm an investor in a project and this project is named blah, 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 and put it in a hospital or healthcare industry, I'm expecting profit in there. It's not about only the mission, but I'm not expecting to put money and not take a return on it. And if I'm having a job in a career that's in administration or nursing or whatever, and I want a quality life for myself and my family, so it needs to be acknowledged. If I'm leaving my family, and for instance, especially in the Middle East and most of the GCC countries, most of the healthcare professionals are non-locals. So they expect to send something back to home or maybe do some investments. The duration they are there and living in this country or doing this profession while they're staying in the period of their stay, especially that they are at high risk to be replaced at any time. So in a way, this all needs to be acknowledged, seen, and when the team collectively sees this and integrates this, the team creates a collective wisdom on how they can deal with it, rather than, putting it in the shadows or not acknowledging it or resisting its presence, denying its presence, acting as if there is no elephant in the room, nobody's talking about it. So in a way, when you bring it there and it's put as part of the team process and dynamics, the team excels through its emergence properties and its learnability to create something around it and work around this and create something that's meaningful. I'm not sure what will happen. I'm very curious to know what will happen when this happens in the healthcare industry, but it works in all other industries. So why not? They're human beings. They're having conflicting agendas. You can say about it, engineers and workers in the manufacturing industries. Lots of case studies there. They're also in the management and maybe supporting functions in service industries. You can see a lot of, like to collaborate about customer-centric approaches. Coaching is doing magic there, acknowledging all the stakeholders' interests, the team interests, collecting the voices, acknowledging them, working on conflict resolution, and maybe sharpening the competency development. After acknowledging all of this, maybe you need to acknowledge some competencies to be built that can create cross collaboration, that can create a way to deal with these conflicts, with these stresses. I'm not sure what will happen there, but there may be a new potential. When you acknowledge these voices, there may be a different kind of information that can actually create a new potential through the process of development of this team and the organizations of healthcare. And through feedback and learning, it's not a one-time deal. It's something that should be ongoing. And through learning and changeability, get feedback and then move another step, get feedback and move another step. You don't know what will happen there, but you're talking about a lot of transformations taking place at the same time. And team coaching is holding the space for this learning and change management to happen.
So you put the team coaching competences and the position of enabler of transformation, either for the alignment and empowerment. From this circle, I can't agree more. I think also we have this chat mentioning about the financial side, the commercial side. It's a very important KPI, but the readiness here for the healthcare system, it's different. It's based on the percent of out of the pockets. Usually, the healthcare system have two types. One part related to the payer side, which is in the well-matured system, the insurance companies, either government or private, they pay for the healthcare systems services. But on the other systems, the out of the pocket percent is high. So it's non-covered services paid by the patient itself. This could be a disabler or challenging point to make this transformation easier. It could help, but we have to put in our understand the financial side, how to interpret with this decision.
I like how you're bringing it, Haitham, and here I believe that teams in the healthcare systems, they understand this. So giving them the accountability of their development process while acknowledging what is present without really shame and psychological safety, this is what's important here to get these voices out in a psychological safe environment and the learning environment. And they may have the ownership to understand if this is the case, how to handle it and how to handle it effectively in a way, and actually facilitating even some focus groups with, if you look at the stakeholders and the clients and the system of the national system, as part of the system of the team, you may actually facilitate some focus groups with representatives of specific cases that can actually come in as, as this you're saying, that's the above the bottom line or the extra leverage that comes in from the patient themselves. They may actually come and put a solution together. It's always a space where discussions and dialogue may create a lot of learning here. And I'm not sure how it can actually affect the public policy. It's not something that happens within the team only, but it's within the team and the system of around them, whether the stakeholders internally or externally, with the national, even with the policymakers and with others. And it's an ongoing process that never ends. I guess the NHS has something around that.
Yes.
They have NHS in UK, and they're actually leading the world in this space of dialogue and promoting, coaching in this space. But you can't find a lot like them doing the same thing.
Actually, I need to acknowledge Noel's contribution. I guess he have a very good questions on the chat, as long as he have a part of our discussion. He mentioned what you said, Sharaf, exactly related to the empowering of the patient group as well. And here it will be related to the awareness of the patient about their rights and how they interpret the decision and sharing the knowledge. This awareness level, it's vary, and it could be a very good tool for stakeholder alignment and empowerment, as you mentioned, Sharaf, for the right direction. If we go with this way and the patient play the role to know his right or her right to contribute on the right decision, to understand that this decision is related to my health, I have to make the right plan, The role of healthcare practitioner is a facilitator to take this decision. This will improve the compliance. This will include the engagement and could be a good step forward to link this dimension for better transformation of healthcare.
Yeah.
Thank you. Sure.
Yeah, thank you. And I believe that opportunities that happen as a lateral, byproduct of any team coaching assignment. It's always, like you find better communication patterns. You find that people collaborate better because they understand more about each other. It doesn't mean that you promote love between the team members. They don't have to. But they understand how to relate to each other and how to focus on the essence of why they're here and how to make it better with the least waste or the least entropy, as we say, the energy that is wasted. Also, I believe that there is a common challenge in the healthcare system, which is the hierarchy, because of the expertise of the doctors and authorities that are there in the healthcare system, whether nursing management, nursing seniority, doctor seniority, and sometimes administration and management empowerment. So most of the organizations are hierarchical, and there are some challenges within the generations, and it needs sometimes to be addressed, especially with the freshmen as fresh doctors or fresh nurses. Sometimes they feel, like you find there's a lot of turnover because sometimes they're not understood, they're not acknowledged, so how to make it, for them, a less stressful life, and at the same time, you promote learnability and exposure. It's something that needs to be maybe addressed. Also, the power dynamics between the healthcare administration and the doctors, and as well the nurses. There's a lot of power dynamics happening there between the three. Also, equity and inclusion is coming up as one of the major trends around the world, and I believe the healthcare sector is also maybe looking forward for something and answers about it. How to promote equity and inclusion, especially with the nationalization in GCC and maybe in other countries, it comes in with different flavors of understanding of what is equity and inclusion. So team coaching, these are all, byproducts of working with team coaches. So I'm not sure how it will impact the healthcare, and maybe I'd just like to learn from others and from the audience here and from you, Haitham, if these things are actually coming in as part of the process of team coaching as lateral results of team coaching, bilateral results. How can healthcare transformations escalate or rapid? How it can be expedited better?
I guess we have now the roadmap of benefit from using the team coaching in collaborative patient-centered care. We do understand that it is not on the ground happen 100%, but as Lena mentioned on the chat, we still have a challenge in the multidisciplinary team. By this benefit, if we implement it or link it to learn how we conduct this, I guess the outcome it will be with high value to all the stakeholders, for healthcare system, for healthcare practitioner, for patient as well. One of the mentioned, it's eye-catchy for me for the generational gap. For healthcare, the seniority coming from generational gap and knowledge as well. Equity and inclusion coming from generational gap. Collaboration, the opposite side of the collaboration is the politics and power span for each one. If the team coaching gives the space for these different generations to talk with each other, definitely new generations have the tech savvy, which play a very important role in transformation. If the old generation didn't learn how to be a tech savvy from the new generation, transformation will take longer time. The good thing, I do understand that based on my small experience and based on small cases in my small experience, it could be small examples, but I will consider it as a light at the end that we can aim to replicate. The discussion between the multidisciplinary team and the mindset of the leader who can build the trust between the team to talk loudly with the challenges, with failures, with options, with new approaches. If we build this culture of trust, I guess this will help for better healthcare system. This is from my point, Sharaf, and Rasha mentioned in the chat as well that talking about the level of trust and how trust can benefit the hierarchy and the level of power. Keyword very important about the outcome of the team coaching here, how we can build more trust in the multidisciplinary team.
I actually love the inputs actually from everyone, from Lina, from Rasha, from Noel, and really they're adding a lot. And you're all, you know, like if you want even to open the mic and contribute in the discussion, just raise your hand and please, you know, like it's a panel discussion and maybe we are just opening ideas here and we think, you know, like the synergy that can happen between team coaching and healthcare. And if you have a case where you already worked this out in the healthcare industry, please let us know, because we are collecting about cases and see a potential opportunity here where we can actually move things in the healthcare industry and the transformations through the use of team coaching and building more awareness about that. So, here Noel is saying, I would propose to have this done from an institution level approach. I think applying it in controlled environment, like a single tertiary hospital, can be successful in it. Then this can be presented as a case to the bigger stakeholders like the national government or even the local government units. And this is a great, you know, like idea when we're talking about sampling or maybe starting with a micro trial or a micro, you know, like as a piloting. And then after the piloting, we can get a lot of information, a lot of experience, and we can actually elaborate and build more about the model. Lina is raising her hand. Please go ahead, open the mic.
Yeah, actually, already Saudi Arabia, they are doing this pilot experience and already implemented it on one of the health institutions in Saudi Arabia. And I have the privilege of being part of this multidisciplinary team there. And actually, the patient satisfaction in that model, it was the main thing. The more that we have feedback from the patient, the more that they feel that this service, it should be there. Okay. And also a team coaching. If we are talking about team coaching is very important there, because it can change the mindset of the multidisciplinary team as well sometimes, and the mindset of the organization itself, because the feedback from the multidisciplinary team, it will enrich the experience and the process command. It will be faster to implement this in different hospitals or centers.
Oh, lucky you. So please, if you can keep the documentation and share it, that would be great, because actually this is one of the opportunities here that we need more documented cases of applications of team coaching in healthcare industry. Thank you, Lina, for sharing this. Also, Afia is mentioning, I may be involved in a project that supports doctors to group coaching soon, by group coaching. So it is still in the space to start. So that's amazing. Thank you for that. And Kania, she's mentioning that all makes deep sense. Thank you very much for approaching the topic in this way. 2 questions came so far. What distinguishes team coaching in healthcare from team coaching in other industries? What are your points of view, observations, and your experiences? So what do you think, Haitham? This question is really amazing. So
thank you for the question. I guess the simplest part is the beneficiary is a human. If the healthcare, our product and our services focusing on the human outcome, team coaching here have three dimensions of the benefit from my point of view. First one, of the patient outcome. And it will not be limited to this. It is important, but it also important to include the experience of the provider. Team coaching will have the contribution for less burnout. The most important reason in burnouts coming from conflict resolution, coming from interconnected team missing part. Third part is the system benefit, how it will be overcome and sustainable, providing service for longer time, for more patient with better outcome. And this, I guess, this is the three dimensions that we can benefit the team coaching in healthcare. I hope I answered your question.
These are great responses, Haitham. I guess we can add to it. Also, I believe that whoever is doing the team coaching in healthcare industry has to have domain knowledge. You know, like in some industries, you know, like when we go to, for instance, for sales teams, and we do team coaching there, you should have somebody from the co-coaches at least to have domain knowledge of sales, because sales have their own mindsets. If you're doing it in so I believe that the healthcare domain knowledge is something that is needed to gain trust and understand the dynamics and the deeper level issues, you know, rather than others who are actually coaches who are coming in from different disciplines or industries don't know about it. So maybe supporting the team of co-coaches, you know, especially in team coaching, there is the concept of co-coaching. So in a way, there can be a coach and there can be a co-coach, two co-coaches working together, one of them with the domain knowledge and one of them may have the team coaching expertise more, you know, heavily and with other industries. So this can cross-pollinate and can support the team to leverage their growth. At the same time, I believe that addressing the emotional intelligence and conflict patterns, maybe understanding more about the conflicts, emotional intelligence, understanding more about the team dynamics, and also the interdisciplinary teams. They are always in the team coaching process. They are always addressed as one entity. So this forces them to work together, think together, create their own wisdom together, and maybe it doesn't defy or it doesn't negate or it doesn't deny the ranks and privileges. It doesn't mean working as a single entity that they are not having their hierarchical ranks, but it means that they're getting into being more humanistic, more empathetic, more understanding to each other, and more acknowledging the privileges and power of each one. You know, so, and this also promotes the continuous improvement. So I guess these are mostly the things that we saw that maybe more or less can be different in coaching healthcare industry, team coaching in the healthcare industry, besides what you said, Haitham. So these three. The second question is, what surprised you the most in conducting team coaching process in the healthcare industry? As I said in the beginning, I didn't do it yet, but I see it's a huge opportunity. So those who are having experience in that, please share with us. We'd like to have more documented experiences and more case studies, and this is something that we don't have. You want to add to this, Haitham?
I have a small experience in this, Sharaf, if you allow me, putting in the primary care sector to include a multidisciplinary team about the diabetic patient. One of the challenges here that surprised me that some specialties like endocrinologists didn't believe of the role of the clinical pharmacist and the patient outcome. This is from my side, it was very surprising in initiating these projects. Although at the end of the time of this journey, clinical pharmacists play a very important role in patient counseling and improve the adherence to medication by playing the right important role and minimize the load on the endocrinologist visit. But it needs to prove the concept and measuring in each step the quadruple aim of the outcome. Is the patient satisfied? If there is any clinical outcome, what about the cost? are you as a provider satisfied or not? If you put this checking point on each step, this could be a proof of concept.
Wow. Well, Haitham, thank you for that. And I believe that, there is a comment from Adeline, and she's mentioning that in Philippines, we are working with one of the major hospitals, and they named the project Moonshot, and achieved a growth of 20%. Buy-in of top management was very important. Thank you for that. Thank you, Adeline, for mentioning this. Next level is jump to Jupiter, where the clients and the senior leadership teams and use the team coaching tools in working together to achieve their project objectives. Please document it, please, and share it.
And one thing, if you allow me, Sharaf, for this, 20% gross for good money. This is the rule of the leadership. We have to believe that protecting the business of healthcare by putting improvement in financial, it's a good thing. But how we make it a good money or improvement in the right direction, here is the point. And as Sharaf mentioned, documented, it could be a very good start or inspiring for other team.
Yes, please. And here, Noel is mentioning top management support and belief in team coaching in any industry is very, very critical. And yes, this is something the stakeholders are the major, like in the beginning of the contracting and in the middle, in the end, their satisfaction is crucial and their buy-in. And here, I believe, thank you for mentioning all of this. Let's move to the next point, which is, like we have mentioned lots of things about that, like what are the healthcare top management issues. And most of them are issues that are handled in other industries. So when we look at it, what is really, team coaching is doing a lot of amazing work when we're talking about stress and burnout, when we're talking about the risk management and working with customer satisfaction. I'm not talking about healthcare. I know in healthcare, it's more critical because its lives are at stake. But when we talk about, like risk management and client-centered approach in different industries, if we're having a model about this, team coaching is doing a great job there. How to create more compliance and better effective decision-making. Team coaching has results in other industries, so why not in healthcare? Working with ranks, prejudices, culture differences. This is also power and rank. These are all issues that team coaching is hugely effective in. Hierarchy and interdisciplinary coordination. This is the game of team coaching, and this is why team coaching has been introduced. So in a way, I believe that these components, if they're the major challenges of healthcare, it needs more courageous professionals and decision makers to embrace it and start implementing it in the healthcare, because and the opportunities that we see, it's integrating of team coaching in the healthcare culture transformations and major transformations. It has to be embraced with courage and huge buy-in from the leadership. We need documentation, and sharing of findings and learnings and continuous improvement. This cycle, in a way, we are asking for the healthcare, and this is a call out, and I'm not sure, today we have 13 attendees, but maybe, like these 13 may actually ripple out to other circles, more evidence, more support. We can actually create a focus group or support group, or maybe through the health community of practice that you're co-leading, Haitham. Maybe we can do something, like to maybe promote this around the world and work with it around the world. And this is.
Please. Please, Sharaf, continue. I'm sorry.
Yeah. So this is something, I guess it's just a call out, and maybe we can do something about it. Maybe the most, the best candidates to become team coaches and work with the teams are the administration management, the physical consultants, the physician consultants, or the doctors, the doctor consultants. I'm not into actually addressing team coaching to younger, smaller generations, because actually they may get, if they don't have the proper buy-in from their leadership or their management, they may feel drained or discouraged by the resistance that they will face, especially that they will believe in it and its power once it's there. So I'm rather into the mid to senior level practitioners and empowered individuals in the healthcare industry to embrace it and become team coaches and work department heads, depending on the culture of the healthcare system and hospital nursing management and leadership, hospital management, healthcare policymakers, governmental and non-governmental policymakers are actually welcome to join the team coaching, community and become team coaches and experience and support their teams with team coaching and healthcare management consultants who are working from, to leverage the transformations in the healthcare sector. And there are lots of transformations happening. Most of them are process oriented, are mostly hierarchical, are mostly quality systems. Yet a few of them are talking about the dynamics and the team. So introducing this as a leverage or a step of more, that would be much, much great. So, and this is the call out for, whoever you identify yourself with, like this, or have a connection with, this is, like a space where new team coaches can create ripple impacts afterwards. Anything here, Haitham, you want to add?
No, from my side, Sharaf, I guess this is the stakeholders and very important players. Noel mentioned in the chat we can't include the executive from the pharma, and here it's have two benefits for the healthcare system. Also, the other part related to the team related inside the pharmaceutical to understand the patient centricity, or didn't forget the patient centricity. Totally agree what mentioned from Noel.
Thank you for that. And for those who are attending our webinar, and this is something, like we like to share out. So if you're interested in getting team coaching education, we are having a public cohort that will be our 5th cohort coming up in September 2024. You can get your 15% discount from its official pricing. Or maybe if you want this program to be run for a special cohort for maybe a hospital you're in, or a team that you're working with, or or even any place in the world, like you want a special cohort, we can actually connect with me directly over the email, and maybe you can agree. The minimum number of attendees in a cohort is 6, and then we can actually agree on the logistics and this stuff. So it can be delivered either in Arabic or English. So these two, it's an accredited program of 80 hours. It includes group supervision and practice coaching. So you can just, so this is our soft offer for attendees. So. Yeah, Anna is mentioning it was a great session. Thank you. I have a strong feeling that you are leading the way in the world of healthcare. May I ask you if you intend to cooperate with other countries, expand your healthcare efforts in other parts of the world? Definitely, with the support of locals, especially that each country has its own healthcare system, its culture, and maybe whatever we can do, we can support with local. And maybe the language will only be and English now is mostly an international language that's understood with everyone. So maybe sometimes in some countries, it may be a language barrier with some people. So we may need locals to support us. So thank you for that. Haitham, anything you want to say here?
Keep connected, Anna. We need to build a community of practice globally. We will be happy to have one unity for focusing about the transformation of healthcare. Definitely, we will find a solution if we still connected to each other.
I believe so too. So I guess we still have something like 20 minutes in our promised time to deliver this session. We promised you it's 90 minutes, but it's an open forum now. We finished like what we needed to say, and it's maybe an open discussion for everyone to contribute. Feel free to open your mic, to raise your hand, to put a comment, to keep the discussion ongoing.
I'm quite sure that we have a lot of experience here, diversified experience from the audience. So I encourage everyone to share their insights, experience, decisions, whatever they come in their mind. As we sharing about this topic will be very important in this stage.
Hi, this is Noel from the Philippines. First of all, I just would like to thank for this very short invitation. I was just invited this morning to join this session to our Viber chat from ICF Philippines. There are two of us here in the Philippines. It's me and Edlin. And Edwin was able to share some the moonshot story, and I think it's very inspiring for all of us, especially they're one of our biggest clients. I'm not part of that program, but I'm part of the ICF training institution that is running that program for them, and that's why it's really important for us to really highlight that. I came from the pharma industry for the past 30 years. Patient centricity is it's a word that we always use, at least in the last 10 years. Especially I came from marketing, so a lot of our marketing materials are said to be patient-centric. But of course, the truth of the matter is that the way we describe patient centricity here in this forum is different from how we used to describe it in the industry. So it's now that I'm a certified team coach as well from LIM. It's a challenging me to personally go with that and support whatever you guys are doing. I think it's really good that some people from at your level, I've checked your profiles, I hope you don't mind. Highly credentialed coaches are doing this. As I said in the chat, I'm very passionate about healthcare because I've been in that industry for the longest and for the rest of my life. Yeah, so just kudos to all of you, to both of you most especially. Edeline went on cam, so you might want to say something, Edeline.
Hi, yes, hello. So,
Hi.
yeah, well, oh, I didn't know about your background, so it really, yeah, touched me. Actually, when I was doing my team coaching practice, we actually worked with Philippine Alliance for Patient Organizations as well. So we also conducted team coaching tools for their group. They kind of changed leadership. Some are leaving. They have new members coming on for the board. So that's also one thing that is very significant as well. So that's PAPO, Patient Alliance, Philippine Alliance for Patient Organization. So yeah, very exciting. Thank you.
Thank you, Noel and Edeline, for mentioning this. I guess you mentioned two important issues. For the pharmaceutical companies, as your experience, Noel, pharmaceutical company play very important role internally and externally. Sponsoring this kind of project for the healthcare system will raise awareness as well. As long as you play this role, it's a very good to facilitate the transformation. What mentioned by Edeline, the patient groups, its contribution and the health system different from country to country. For the better mature system, patient groups have a very important role on raising about awareness about patient rights and contribution of the patient in the decision. Empowering them with the team coaching concepts will build thought-provoking discussion with the healthcare practitioner. So from each side, you can find the stakeholder can benefit from team coaching, but the keeping on our mind, the quadruple aim, it will be our KPI for the success of the team coaching. If they have outpatient outcome for the patient satisfaction, for the cost and how we can measure it, and ended by the burnout level. If we have less burnout, we will keep healthier. Thank you for sharing this insightful discussion. Thank you. Highly appreciate, and thank you for being with us today. Sharaf, if you need to.
I actually love the adoption and the collaboration of ICF Philippines with the healthcare industry and the organization PAOP. You mentioned that the Philippines Organization for Healthcare. And I guess it's amazing to have such collaborations in such countries. This takes it to a systemic level, and to real it pivots really the transformations to happen. And I believe that if we're here in ICW and maybe promoting something to other chapters, this can be a great direction for other chapters to learn from what's happening in ICF Philippines. And at the same time, I believe there are specificities in each healthcare system and patient centricity for each country that's localized. And I believe putting this intact with the local organizations working together to figure it out and create a pave a way for that, and maybe addressing this through local team coaches. That's amazing. And sharing experiences globally with other practices around the world. And I guess what we can do is just we are just putting ideas there and cross-pollinating, especially that's, for instance, here in Egypt, we have zero knowledge of something that's happening like this. I'm from Egypt originally. In the GCC, there's an initiative that's happening in the healthcare industry of Oman. There is 2030 in Saudi Arabia, but we rarely listen or learn about things that are happening elsewhere. So it's in a way like it's crawling a little bit, very slowly in different parts of the world. And I believe that who are pioneering will teach others who are coming afterwards. So we're just putting, the ideas around and hoping things will go to the best. And thank you for sharing this, Noel and Italy. Yeah.
Thank you.
You're welcome.
Anyone need to share their insights? Still, we have an expert here. We need to hear from you how we can move forward together. Anna, please.
Hello. I just wanted to say, I'm really grateful for your session and the way how you conducted that today meeting. It was a dialogue, and I really appreciate your partnership during that dialogue. And being honest, I decided to take part in this webinar. I'm not in a healthcare market. However, right now, and this is, last 2 months, I started to have individual coaching clients from this kind of industry. And I learn, and try to understand how this industry is working from the inside, because, I'm also a patient. I have a child, so sometimes we are visiting hospitals and doctors. So I can see that world like a client, not being inside. That's why it is so important for me to understand better my clients and also the industry to, support them in a more effective, better way, like during individual coaching. However, I have the quite interesting reflection that it is also perhaps connected with the culture, because more collective cultures probably are more used to cooperate and collaborate, and maybe there is something important, I guess, and I cannot name it so far. However, my observation is that the cultures, like here in Poland, we are quite individual. People are quite focused on themselves, unfortunately. And it happened that everywhere when you meet with other people, they are focused on themselves mostly, and there's less of collaboration. And probably when we are going into west of Europe, it might be even more complicated, that people are so close, they are not open for cooperation. So that's why also this cultural context might be quite interesting to inspire by the more collective cultures, how they used to cooperate and how they used to communicate. I have the feelings that we can also learn a lot from other cultures. In that case, what do you think? What do you think?
I guess for like the EMCC, or European Mentoring and Coaching Council, which is based in Europe. Europe is well known for its more individualistic approach, and like they were the ones who led the team coaching, because they felt that this is a transformation that is needed in the community, and moving from individual practitioners to collective practitioners, and looking at the team as one entity was one of the transformations that led the presence of team coaching. And now, like, I guess you have a lot of experience in Europe and in conducting team coaching, but less case studies in healthcare sector, but maybe in other industries. There are a lot of success factors conducting team development techniques, including team coaching and, looking at the team and culture transformation that has been happening there. And I guess we can learn from that. It's accessible around you. I'm not sure in Poland, I don't have lots of connections in Poland itself, but maybe I have in Germany, in UK, in Belgium, in Netherlands, in Greece, like there are lots of, the country is not very, very far away, or not, like when it comes to individualism versus collectivism and the collective mindsets. And I guess team coaching is doing great in the industries it was introduced in. So in a way, maybe moving from looking at teams as individuals into looking to them as one entity. This is the major transformation. The practitioner and the stakeholders may have to maybe look at it as a lens to work with the challenges they are facing, instead of taking individually the healthcare management, the doctors, the nurses, and doing individual like development. They should work with them as interdisciplinary teams with cross-functional projects, and like with the way that they can comprehend and relate to in the space where they are already growing and perceiving value.
Yeah. Yes, thank you so much. It was very provocative discussion, and I'm staying with a lot of reflections after this meeting. Thank you so much.
You're welcome. Thank you, Anna, for sharing this.
Thank you. Thank you. I guess, Sharaf, we still have 10 minutes, and I guess we still have stories to tell for the remaining. I guess we learn from your experience and your insights. We need to move forward from here to better global healthcare system.
Yeah. I guess maybe we can mention a little bit of some of the documented cases that have been mentioned in NHS. It's not our cases. It's not mine. I didn't work with it. But it's mentioned there in the literature, and that's why we're asking people to put more literature, because the world needs to believe more in the power of team coaching and what it brings to the team. It's not about the team coaching itself as a service or ICF. It's an opportunity that here in ICF we're having this, but looking at the team as one entity and resolving the cultural issues with the healthcare management. This is what we need to focus on. Name it whatever you want to name it, but it's something that needs to be addressed, and we may have something that can benefit this space. So maybe there was a case that was mentioned in the National Health NHS hospitals, when they actually studied, there was a study that was published that was mentioned that there was a multidisciplinary team where the coaching interventions helped the team address the communication barriers and build trust among members from different disciplines. This was typically what we're talking about. What the results of this deeper understanding of the patient needs, improved collaboration, and more patient-centric approach. And actually, it was one of the NHS published papers that was actually mentioned the power of team coaching. And this is maybe the single team coaching paper that has been published around and talking about team coaching and interdisciplinary teams. The others were actually more of coaching, maybe nursing managers, coaching healthcare professionals for burnouts, coaching, people, like the healthcare professionals in Mayo Clinic. There are lots of others, taking like a sample of the pediatric emergency department and working cross-functionally. These were some of the cases that were actually discussed. So maybe doing a thorough search of papers published in the impact of coaching in healthcare, you may find a little bit of documented research. It needs much, much more versus the other industries where you can find rich findings and rich case studies and richer, especially in the technology sector, industrial sector, FMCG sector, and maybe pharmaceutical sector. We have a lot of case studies there mentioning the power of team coaching and how it impacted the team and the cultural transformations and this stuff. So
I guess, Sharaf, and those participants here, the key word here, it's related. Let's try. Let's keep trying. From this point, I guess we can build the proof of the concept across the different healthcare system. Here, keeping connected, that's mean we can share our insights. LinkedIn is a good platform for all of us to share thoughts, ideas, implementation, fall down even, to learn about how we can move forward. Healthcare, well needed transformation, the readiness and maturity of the systems is different from country to country, but we have a common ground we can start with, but with some local reflection or local customization, we will get better health across the world. This is, I guess, our intention to move forward together. I guess now we reach a good solid point to start with. How do you find, Sharaf?
Yes, very much. And I want to thank everyone who is contributing here, Noel, Anna, Eileen, Rasha, Alina, and everyone who is actually attending with us, Nasreen, Raja, and Shakran. I believe that you added a lot to the conversation and discussion. And those who even left earlier, I believe that it was, I'm very thankful for that, really very thankful. And I hope we connect on LinkedIn and we continue our conversations. And I guess it falls in the territory of you, Haitham, just to in the healthcare community of practice. Yeah. Do you like to maybe talk about the healthcare community of practice and health and wellness community of practice in ICF, maybe to bring the attention of what it handles in ICF ecosystem and how people contribute in it? So please. Yeah.
Thank you, Sharaf, for offering me this time. In community of practice, I'm part of 3 team, Helen and Antonella. We are working together closely to raise the awareness about the health and wellness. One of the very important part of the scope, we have 2 directions. First one related to the healthcare system and how we embedded coaching to be enabler for healthcare transformation. I guess we had just complete the webinar during the ICW talking about ADHD patient and how we can coaching supporting them. The second direction is related to well-being in workplace and how coaching be a good tool to improve the well-being in workplace, especially the records show that there is dissatisfied employee across the world. And from these 2 dimensions, we usually build the quarterly webinar talking about topic related to these 2 directions. For the ICF members, I do recommend that we follow us on Engage. I put the thread on the Engage platform, so you can find the community of practice, health and wellness community of practice. And also for a short period, maybe less than a month, on the LinkedIn group. But usually we will continue our discussion on Engage. We have plus 3,000 members in the community of practice, but we need more because it's a individual responsibility for everyone in ICF to have place to contribute, either for healthcare system or in workplace in general. This is the community of practice in short statement.
Thank you. Thank you, Haitham. And I believe the community of practice are more than 10, and they are currently 10 in ICF. And it's open and it provides free webinars and with experts from around the world. It's really, it provides CCEs for continuous development. And it's the contribution and volunteering is very beneficial. I've been in team and group coaching community of practice, and it's really very educational and supports you to develop both personally and those around you also. You share the benefits of learning with everyone. So thank you, Haitham, for explaining this. So now we have 2 minutes. So if you have a final word, we are learning from you. Thank you. Can you share with us more information? We can join it. Yes, we can send.
Yeah, sure.
Yeah.
I will put the link of thread. We can you can follow. Just
yes, we can share the recording of this session. We'll see which channel will be best for that. Okay. And we'll inform you through the email. You already registered in the. Yeah. Thank you, everyone, and have a nice day.
thank you.
Bye-bye. Bye-bye.
Thank you very much.
Thank you.
Bye. Bye.